Okay, we'll go ahead and get started. So welcome everybody. Today's meeting's topic is the Trauma-Informed Workplace Certification. The State of Tennessee Department of Health recently contracted with Ballad, ETSU Strong Brain Institute, Bristol's Promise, and other partners across the state to develop a trauma-informed workplace recognition program. And so we wanted to share this information with you guys so that you all in turn can share information throughout your groups with your folks. So here with us today, we have two folks that have been instrumental in every step of this process, becoming an exciting reality for our folks in our community. First, we have Wally Dixon here with us. Wally, if you can say hi. He is the founding director of the Strong Brain Institute and the chair of the psychology department at ETSU. And second, we have our very own Melissa Roberts, who is the executive director of Bristol's Promise and wears so many other hats that I ran out of actual room to write them on my notes and my piece of paper. But they both have just been such an instrumental part of seeing this visualization come to reality. And so we're super excited to share with you guys today and hope that you will take it and share forth. So Wally, Melissa, whenever you guys are ready, I can graciously turn that over to you all.
Great, thank you. So what I thought we would do today, I do have a PowerPoint that I'm going to share with you all, and Wally and I are going to kind of tag team it a little bit. But I wanted to share with you kind of how we got here. And then Wally's going to share some of the details of what the project actually looks like. So Tennessee Department of Health and the Ballad Health Strong Brain Institute at ETSU contracted to create a trauma-informed workplace recognition project for the state of Tennessee. And when the contract was signed, we had 6 months to pull this together. So it was a very lofty goal, but I am excited to announce that we met every single one of the deliverables and the goals on the contract. So that's always an exciting thing. Some of the partners that were instrumental in the core of this, we called our steering wheel. So Becky Haas was involved in the process. I know many of you know her. She, started in Johnson City and has since kind of expanded beyond our region and is speaking nationally and internationally, doing trauma-informed training. Also, the ETSU Research Corporation, they were kind of overseeing the marketing portion of it. So they created the colors that you see, the logo that you see, the website that we'll be looking at in a little bit. Of course, the ETSU Strong Brain Institute was instrumental on lots of levels. Dr. Dixon and Dr. Andy Clemens, Megan Quinn, all kind of came together to work on this. We had some great graduate assistants who helped. And then Bristol's Promise served as the project manager for this. So we were the ones that were kind of herding cats, so to speak. And the first thing that we wanted to do was we wanted to look at who we were going to bring in as kind of consultants on this. Who were the subject matter experts? And we wanted to be very intentional about diversity so that we had a variety of thought processes and backgrounds and experience and even geography. So thankfully, we were able to get people who joined us and who agreed to serve on this project from all three of the Grand Divisions of Tennessee. So we have representation from the Eastern Division, the Middle Division, and the Western Division, all the way down in Memphis. And that was really important because, what we look like in Northeast Tennessee is different than what, the Western Division looks like over in Memphis. And so we needed to have, again, that diversity of thought to bring this project together. And the consulting constituents that we talked with and that agreed to support this project and help facilitate this project were really diverse in their background. We had several divisions of the Tennessee Department of Health. We also had the Tennessee Department of Education that attended these constituent meetings. We had the executive director of PACE's Connection, which most of you are familiar with. If not, then we can definitely share that link. The Tennessee Association of Mental Health Organizations, the director of the Sycamore Institute, which does a fantastic job of looking at data and kind of creating social math to help people understand data, Tennessee Commission on Children and Youth, The Tennessee chapter of the American Academy of Pediatrics, we had the past president serving on that. And then the Center of Excellence for Infant and Early Childhood Mental Health Consultation. So you can see that these people are really deeply involved in the work that we were doing and had great thoughts and ideas. So as one of my coworkers loves to say, the best way to eat an elephant is one bite at a time. And the first thing that we did was we looked at the contract to see what the deliverables were and what the goals were and put those into kind of buckets. And these are the buckets that we came up with. The policies and best practices was led by Dr. Dixon, and they looked at policies and practices that were being used throughout the United States. We didn't want to reinvent the wheel. We wanted to be able to make the wheel fit for our state, for the work that we were doing. And so that was the policy and best practices. Marketing and communication was led by Dr. Audrey DePelto with the ETSU Research Corp. And they looked at color schemes and they looked at emotional color responses and did a lot of work on the marketing part of it. Resources and training was led by Becky Haas. And that was looking at what resources do our businesses and organizations need to be able to become trauma informed. And then data and evaluation was led by Dr. Andy Clemens and Dr. Megan Quinn, who do a great job of diving into those details of how do we measure this in a way that allows us to understand, is this working? Is it changing cultures in organizations and businesses? So that was kind of the groundwork that we laid for this. And I'm going to turn it over to Wally as I go to the next slide so you can see just a few of the places we looked at for lit review.
All right, thank you very much, Melissa. And I have to say that wearing my hat as a department chair, academic department chair, I've been siloed my entire professional career in academia. So working with Melissa was really such a delight, and she's very trauma informed, putting up with me as a academic, and it was just a delight to be able to work with somebody in the community to put together this project, and learning how to work with somebody from the community. I'm still developing, and as a developmental psychologist, that's good to be able to say because you don't want to stop developing. And so the whole project was fun, and in many ways it was fun. And also working with the State Department of Health. I would say that the State Department of Health approached us to do the project. We didn't approach them. We didn't know that they were interested in this. And it was specifically the Office of Injury Prevention, and Terry Love, who is in the Office of Injury Prevention, was kind of our project, not project director, but the representative from that office that we reported to. And as Melissa said, it was really important for us to not reinvent the wheel. And so a lot of what we developed in the trauma-informed workplace recognition was based on this document, which is free and available, which there you go. You can download it. I can send it to you. It's the University at Buffalo School of Social Work Trauma-Informed Organizational Change Manual. And they put this together in about 2019. And things have changed since 2019, despite, in addition to the pandemic, just thinking about trauma-informed and resilience-informed practices have changed a lot. So in the manual, what they say is feel free to use any part of this and use as much or as little as you want. And so we use that as our guiding framework, but we also have embedded some of our ideas that we've developed locally and also in conjunction with recent publications, like, for example, the 4 Stages of Psychological Safety that came out by Timothy Clark. I don't know if Melissa would agree with me, but I think one of the most important foundational elements of a trauma-informed workplace is establishing psychological safety. I think that's probably the most important thing. And so I embedded that in the as a key element of the 4 stages. And I just lost my page. I shouldn't have picked it up and showed it to you. And we use the SAMHSA trauma-informed care principles, the 6 principles that many of you are probably familiar with. And we were informed by other documents that were related, but not necessarily trauma-informed, like the American Psychological Association Psychologically Healthy Workplaces Awards Program. which a lot of what makes a healthy workplace are trauma-informed principles. Surprise, surprise. Okay, go to the next slide. One of the things that we thought was most important is getting the head of the organization or agency fully engaged with the process, because we don't think, and I think there's literature to support that if it's not top down, it's not going to happen. We think that the head has to be the person, and we went back and forth using the term CEO or owner, and we landed on head as a generic term. And by the way, we, happy to receive feedback at this point. We're still in the process of rolling it out, and if you see something like a glaring omission or some of the language that we should use differently, two or three slides ago, you saw the term consulting constituents. When we were hired to do this, we were asked to by the Office of Injury Prevention to identify stakeholders. Well, since that time and now, stakeholders is a pejorative term. And we didn't know that, and we found out that the CDC gave alternative suggestions. So just this morning, we changed the label from stakeholder to consulting constituents. So it's constantly changing. In any case, feedback would be very well received. But we put together this application process. It is meant to be, it's not the kind of thing where an organization has already been doing trauma-informed stuff and then they just want to get recognized for it. It's more like, no, we're going to lead you through the process, through our process, and you're going to have to do it this way, which means, for example, like the head has to be involved in the application process. We went so far as to say the head is supposed to complete the application process. But also we want human resource. The second most important element is human resource management. People, I don't know if it's true in your agencies, but human resource is probably one of the most powerful agencies or offices on our campus in higher education. And a lot of what happens in our place is determined by human resource. For example, during the pandemic, human resources had to come up with a policy for working from home, and delivering that information. And then, like, what were the instructions for coming back to work? And like, those are really powerful things when you're in the middle of a pandemic, or if you have children at home because school's closed. And human resources makes all those determinations. When you go home sick, how many days off you're allowed, vacation days, R&R days, paid leave, all of that is determined by HR. So HR is really important. But one of the things we want to make sure of is that the head of the organization understands that when people are working on developing a trauma-informed workplace, they are going to not be doing the regular work. So if they're producing widgets, they're going to be producing less widgets during this. And the head needs to say, yeah, I know that, and that's important, and I value that. And so we're going to give the people the space that they need. And nothing happens really can really happen much without the head of the organization agreeing to it. Let's see, what's the next slide? Let's see that real quick. All right, if we could go back. And then one thing that we came up with, a novel approach that we developed, and I think this was based on how Bristol's Promise handles some of their projects, is identifying a navigator. And a navigator is, and we're still working on this, but the navigator is a person who's going to be assigned to an organization who applies to become a trauma-informed workplace. And then the navigator would be assigned by the SBI, and it would be the liaison between the Strong Brain Institute and the workplace, and would carry information back and forth. One of the first things, for example, that we would do with the workplace is to, and I'm foreshadowing what I'm going to say in a couple of minutes, but we'll do an evaluation of the workplace's readiness to be trauma informed. And so the navigator would go into the workplace, distribute an assessment instrument, collect the data, an anonymous assessment instrument through RedCap, so it would be done online, return the data to us, then we would produce a summary report of the organization's sort of readiness for being trauma informed. But part of that's going to be maybe having some hard feedback for the head or the CEO you know, for example, if a lot of people are unhappy, that's going to come out in the assessment, and the head of the organization needs to be prepared for that, and also needs to allow us to see that. So removing any sort of proprietary access that the head would have to workplace data, they would have to acknowledge, yeah, you guys are going to see what, you know, we're going to see our dirty laundry, and that's okay because we want you to help us clean the laundry. Okay, next slide. So we came up in the organizational change manual, they talk about a 3-phase approach, and I thought that was perfect for what we wanted to do. They wanted, the state of Tennessee Office of Injury Prevention wanted a tiered recognition. They have some other programs in place in which there's tiered recognition, so that programs would seek to get the highest level of recommendation. You know, and so I'm immediately thinking like the Olympics, you know, gold, silver, bronze, although I don't particularly like those per se. And so I just landed on, you know, as a Delta Sky Mile frequent flyer, they have designations called silver, gold, and platinum. And so I just chose those and just put them in there as placeholders. And every time I did a presentation, I said, if you can think of better tiered recognition approach, let us know. But these are just placeholders for now, and nobody ever came up with a suggestion for an alternative. So we're still using silver, gold, and platinum. So they correspond, the silver, gold, and platinum correspond with pre-implementation phase, which is phase 1, an implementation phase, which is phase 2, and the sustainability phase, which is phase 3. You can't get the sustainability phase until you're doing the work of phase 1 and phase 2, which could be, you know, anywhere between 18 months and 2 years. So you can't be recognized at the highest level of trauma-informed workplace until you've been doing the work for a period of time. And I thought that was completely appropriate because, you know, you don't want a workplace diving into this just to get the recognition and then stopping the work right away. So they have to demonstrate that they're committed to it over a multi-year period. I say multi-year, meaning more than 1 year. And I'll talk more about that in a second. But in this first pre-implementation phase, this first phase could go kind of quickly. It doesn't have to take a full year. It will have to take some work. It will have to take, we think, several months, but we haven't done it yet, so we don't actually know. But I'm thinking maybe a company could do this in 6 months, maybe it'll take longer. And the focus there is on 4 key development areas. And these key development areas are identified in the Trauma-Informed Change Manual. So we copied them from there and put them here. But the key development areas during pre-implementation focuses on, during pre-implementation, there's a focus on 4 of the, I think there's 7 key development areas: leading and communicating, hiring and orientation practices, establishing a safe environment, and reviewing policies and procedures. At this point, the organization just puts together like a committee, a team, a strategic synergy team, I think we've called it, to develop a strategic synergy plan. And the membership on that committee is going to consist of the CEO, probably somebody from HR, and then various representations from different aspects of the workplace. And depending on the workplace, it could be really different. Like if it's an organization, if it's a car dealership, you know, maybe a salesperson could be on it, and a finance manager or something like that. It would really depend. And then our navigator would work with the workplace to help identify who would be the key, I don't want to say stakeholders here, but the key members of the strategic synergy team to come up with the plan. And then the focus is on, primarily in the first phase, is on these areas. For leading and communicating, all that really happens at this point is there's messaging that goes out where the CEO or whoever's responsible for disseminating information says, hey, we're going to do this. Here's why we're going to do it. We want to be transparent about it. Give us feedback. Hiring and orientation practices at this point, from that point on, then they're going to be changing how they hire, meaning how they word their advertising for positions, how they interview potential candidates for positions, how they onboard candidates once they bring them on board. So they can do that right away. establishing a safe environment. At this point, they're at the first phase, in the pre-implementation, they're not going to be establishing a safe environment. But what they're going to be doing is looking around their environment and seeing, what do we got here? What are the problems that could be fixed? And so that, that requires kind of walking around maybe the physical spaces, looking over some of the policies, and then reviewing policies and procedures for this first phase, identifying the policies and procedures which they think are consistent with a trauma-informed mission. Next phase. So after you do that first thing, you develop a plan, and the strategic synergy plan, once that is developed and sort of approved by us, the Strong Brain Institute, then they're granted the silver recognition. And then that could be, we don't know what that's going to look like. It could be a plaque. It could be something they stick on their window. It's, and it could be both of those or other things too, including an email signature line. But phase two is the heavy lifting. This is the implementation phase. And this is when they continue the communication, messaging, hiring and orientation practices. Oh, I should have said during phase one, we also do some trauma-informed training for the strategic synergy team. So they have training about what trauma-informed is, what ACEs are, those kinds of things. But the rest of the business, the rest of the workplace isn't trained. In phase two, they are trained. The rest of the workforce is trained according to the unique requirements of that agency or workplace. There is beginning to make changes in actually making the trauma-informed, making the environment psychologically safe in particular, but also physically safe. But the vast majority, I think, of human resource during this phase is reviewing all of the policies and procedures with an eye towards trauma-informed. And so, if you're a large organization like East Tennessee State, for example, we must have thousands of policies and procedures. But smaller organizations may not have anything in writing, but they may have rules or standards of practice that really should be placed in writing, that are codified, so that people understand. Well, instead of you saying, yeah, this is the way we do it, you write it down. This is the way we do it. And so part of being trauma-informed is being transparent and being clear. And so if you have policies that aren't written down, like for promotion, for example, then you need to write them down. And so when this is done, which we think will take a year, and if it's not going to take a year, we're making it take a year, because if they can implement some of the practices early, then once they're in force, then they're going to be monitoring the policies, the changes in the workplace to make sure that they're working. All right, next. And then after everything's in place for 1 year, after at the implementation stage, then they get the gold recognition. And then for the following year, then they continue to monitor, continuous quality improvement, although I hate that term, but continually monitoring what they have, making sure things are working for them, tweaking, and they actually use the term tweaking in the manual, tweaking policies to make them a little bit better, identifying things that they thought would work but really aren't working, and replacing them with other things, and doing that for 1 year. And so it's primarily evaluating and monitoring progress during this phase. And after that happens for 1 year, then they can gain the platinum recognition. And that, in my way of thinking, the way we've been talking about it, you're not going to get platinum recognition until you've been doing this work for about 2.5 years. At the earliest, maybe 3 years. Okay, next. Oh, okay. I don't know what this looks like. So do you want to take this, Melissa?
Sure, I do. So a couple of things that we, just in addition to what Wally said, there were things that we were really intentional with. One of those was to make sure that workers were able to opt into this trauma-informed at their own pace. So this wasn't something that came down from the CEO. You have to be trauma-informed. I mean, that's really the antithesis of being trauma-informed. And so we were very cautious in making sure that that was in there. And we were also cautious in our wording, because sometimes there are organizations or businesses that have fantastic policies or procedures that don't need to be changed. And so we didn't want to have this look like we were saying, you need to change everything, you need to redo everything, but just really, as Wally said, reviewing things, making sure that they meet those trauma informed. So the next steps that we have are the website rollout. We have not gotten the website signed off on by Tennessee Department of Health. We do have a meeting with them today to get that done. So you all are going to see this before. And then providing information about the program to key industry leaders and our next steps in the next contract phase for us. We're going to begin piloting with 3 businesses or organizations in the state of Tennessee with a goal of 15 businesses in fiscal year 23. So I wanted to share with you the website. I thought I had it pulled up, but I guess I don't. This is not live yet, but wanted to give you an idea of what the website will look like. This was built out by the ETSU Research Corp. And so you can see that there's the, right there in the middle, we've got the logo that they came up with, and it's really a clean website. It's intended to be easy to navigate. We hope to have some notes there. And then there's a place where you can click to get started, and that will take you to that application process so that we can get that. Mission and vision. The mission is to use data-driven training techniques to improve workplace physical and psychological safety, trust, and employee empowerment, to improve overall workplace culture and increase employee productivity as well as individual well-being. And then our vision is really to improve workplace culture and employee productivity for all of Tennessee. And so you can see the information about Strong Brain Institute. We really felt like it gives a level of weight to have this associated with a higher education organization, to know that this wasn't something that somebody kind of pulled out of their ear, but there's been very intentional thought through it. There's been very intentional work done on it. And these really are best practices. You can also see the team. This is the core team. So Wally and Andy and Megan. Ben Schoenberg was one of the graduate assistants. He did a great job of organizing us. So this is kind of, and then there's a contact, and I don't know, it is live. And so that will kind of, when somebody wants to contact us, or when somebody wants to apply, the Strong Brain Institute will be alerted and begin working on that process of getting a navigator assigned to the organization or the business, and getting the phases started, making sure that they understand what that looks like. And then, of course, recognition. We have the benefits of being a trauma-informed workplace, the benefits of the recognition, and just the benefits of being trauma-informed. So again, trying to allow businesses and organizations to understand this isn't just about getting this recognition. This is really about making your workplace stronger and making your workers stronger and building resilience in your workplace. And then you can see the 3 levels of recognition that Wally went over, the silver, gold, and platinum, and also giving them kind of a timeline of what that might look like. And then again, there's a getting started link. So with that said, here is Dr. Dixon's information to reach out to him, mine as well. But I'm going to go ahead and stop sharing. We would really appreciate any feedback, anything that popped out to you all, any thoughts that you have about this, or any questions that you have.
Well, I'll go. Really sorry. Fantastic work. I mean, I think just looking at the plan and coming from a place where I've been trying to sort of piecemeal and research for quite a while now, I mean, you're doing everything right. That doesn't look like there's anything that you've left unturned in terms of best practices and how this is done. So, I mean, my initial reaction is just absolute excitement. I think it's it's long overdue and needed, and I look forward to seeing it continue to evolve. Yeah, just hats off and well done. I don't have any questions right offhand, but just in terms of initial just sort of unveil, I think it's fantastic, guys, and just congratulations. Those look like a lot has went into this, so well done.
Thank you.
Now, I find this really exciting, and one of the reasons why I was so interested in hearing about this is because I've been trying to put a curriculum together for trauma-informed in churches with pastors, so they can preach with trauma in mind. And so that's why I find it so interesting. And I feel like this is going to lead me to the way I want to do things. So amazing job, definitely.
Thank you, Caroline. And do you have you seen the SAMHSA trauma-informed training for faith organizations?
I have not.
I will send that to you.
Thank you. Yes,
You're
thank
welcome.
you.
Also, is it Eva or Ava?
Sorry, it's Eve. Eva's my first name. I go by Caroline, which is my second
Caroline.
name.
So Andy Clements is one of our collaborators, but she's also on the Strong ACC. Not sure the title, Brittany, of what she's on, but she's a faith-based representative.
Mhm.
What's the name of that?
She's on the Leadership Council.
Leadership Council.
Mhm.
So if you email Andy Clements or email me and I can connect you with her, she is kind of the faith-based leader of trauma-informing churches and pastors and things like that. So if you haven't been in contact with her, she would probably be somebody you should contact.
And
Thank
she
you.
was instrumental in that SAMHSA faith-based. So
Well,
so I
that-
can send you that. Her
That
email.
would be great, because I'm trying to focus like on the Hispanic pastors, because a lot of them do not preach with trauma in the mind. So what they say is, if they have like a mental health issue, they just say, "Oh, pray about it," So definitely.
Yeah.
Yeah.
Yeah, we'll get that out to you.
Thank you.
Thanks, Brittany. Brittany just put Andy Clements' email address in the chat.
You're on it, Brittany.
I do have another question. This is all really great. And I was super excited to hear about it because I've heard y'all mention it briefly in other meetings I've been in. So it's exciting to see it all laid out. So when will, and you may have mentioned this and I missed it, when will like the website go live and all of that start
Well,
happening?
So theoretically, we were waiting until we got the thumbs up from the Office of Injury Prevention to make it live. Because it's not live, we're also not having to pay for it. But the minute it goes live, then we're having to pay for it. But I also, as Melissa was talking about it, I was like, oh my God, once that goes live, people are going to apply. And we're not prepared for that yet. I mean, there's some more legwork we have to do to like accept and review applications. And, like it's been a concept for the last year and a half. It's not been something we've had to do. And the idea of actually doing it's a little scary, but so the thinking was we could go live today, but we just wanted the state of Tennessee to give us the thumbs up on it.
Gotcha. And so the SBI navigators, so they will be employed by you all, Wally?
Well, that has, so we haven't figured that out either. I mean, we do have people who can do it, like who are employed, like Ben Schoenberg, for example. I haven't talked to Becky, but I think she would be a good navigator. Possibly Melissa would be a good navigator if she wanted to. We haven't talked about that piece of it. I mean, I could do it, but what I want to do next, after we get the final thumbs up from the state, is I want to have a retreat for the key folks in the group, the principals, and like sort of hammer this out. What is this going to look like? It's possible we could get volunteers from the community who are interested in doing it. I don't know. I don't want to assume either. But at a minimum, we have 3 or 4 paid people that we could have do it. Also, as a part of this contract, we're hiring an executive aide. If you are on our Strong Brain Institute External Friends listserv, I posted the the posting for our executive aide position yesterday. It's not a high paying job. It pays $26,700, but that person will be a full-time employee of the Institute, and that person could also become a navigator. And so we have a lot of details to iron out first, but yeah, the plan is to start with 3 workplaces that we think are low-hanging fruit. And by low-hanging fruit, I mean people that we know maybe, or that we know are going to be really engaged with this and just, want to do it officially. And then we'll do our own self-navigating and tweaking and continuous quality improvement. And so that will be an iterative process of going out, finding information, changing how we're doing things. So we'll start out with small, and then hopefully they want us to do 15 a year, which I'm worried about a little bit, but we'll start with 3, and then maybe it'll be a smooth rolling machine and we can do 50, no problem. I don't know.
And so I think, what we had talked about was to try to start really rolling this out late Q1, early Q2 of the fiscal year. So we're looking at, late September, October, and then we get into the holidays. But because we really want to start slow with just 3 organizations or businesses, I think that that's going to be easier to do in that timeline. And then maybe in the second half of the contract year, be able to really kind of push out the rest of it, because we'll kind of have our feet under us. It looks great on paper and we're really confident, but until you actually start implementing it, you don't know where the bugs are and where the little twists and turns are. So that's kind of an overview of what we're thinking internally. So if you all know of organizations that you feel like are interested in this, please by all means send it to us. Let us reach out to them.
And I will say, when I look around the room right now, I see a lot of us in nonprofit organizations, right? So I think the challenge for me in the Bristol Connect program, is going to be typical of the challenge you may see is getting those businesses to these meetings, to this table to hear about these things. And so, please talk to your business owners. I mean, at church on Sunday, if y'all are church going people, if you have business owners in your church and you're friends with, talk to them about it, right? Because that's how we're going to have to get the word out, because until we can get our business community to these types of meetings to see this information, they're not going to hear it. So I'm challenging each of you to go find a business owner to talk to about this opportunity, because I think it can be changing for our community, for our economy, and just for our general public and ourselves. It's one of those changes that we get to be part of and make our community better. So I'm challenging each of us to do that. You might want to mention the Bristol Connect program too. I mean, just as a aside, if I'm putting in a plug.
Hey, I'll comment. I think all this sounds wonderful. And I think it's been what we've been waiting on, right? Like this one thing we can get behind. So I think that's great. I love that you're taking it slow and that it's going to take kind of years to do this. I think that's wonderful. So remind me, so the owners of this are Bristol's Promise and the Strong Brain Institute are kind of the ones who are heading this up. And it's funded by who?
So administratively, a contract was signed between ETSU and the Tennessee Department of Health Office of Injury Prevention. And because I knew Melissa was so engaged in community work, I reached out to her first and asked if she would be interested in being hired on as kind of like logistics director, but detail manager and all the other things. And so, at any point, Bristol's Promise could opt out, and then I would have to beg for somebody else to come and play that role. But so Bristol's Promise is kind of a subcontractor for this contract, but that's not to diminish the role that Melissa played in setting this up, because she was like a co-director the whole time.
So it kind of lives, Miranda, with the Tennessee Department of Health Office of Injury Prevention and the Ballad Health Strong Brand Institute at ETSU. Those are the two people who signed that contract and who have that. And I can't see Bristol's Promise dropping out. We're kind of, this is what we've been waiting for too. We've been talking about this for 3 years. So being involved in this project was just, you know, awesome for us.
Yeah, I think, I mean, you've been doing this work, right, for the past couple of years, Melissa. So I think it's perfect for you guys to be at the head of it also. So it's exciting. Yay, congratulations, ton of work.
Thanks. What other feedback do y'all have? Anything that didn't make sense or anything that you all feel needs to be?
So I have a question. So how would have you made a plan on how to address maybe those businesses that have like mostly like Spanish speaking employees that don't speak maybe the language?
No. No, I don't know what we would do in that situation.
Okay.
So in speaking to that a little bit, Caroline, you know, we have worked in the past with people who don't have English as a first language. And we don't have somebody in-house who is fluent in other languages, but I feel like with the full course of ETSU, we would be able to find somebody who was fluent, who understood kind of the nuances of cultural differences, and who could walk through that, because it's more than just language, right? There's a culture, and we want to be mindful of that as we move forward. But at this point, I think that's part of what that retreat will look at, is really that implementation and what that looks like across various organizations, businesses, with different backgrounds.
So I know Melissa mentioned it a couple times. We do welcome feedback. So later this afternoon or tomorrow, when you're in your office and an idea hits you, or a thought comes to you, or a question comes to you, please feel free to reach out via emails. You have Melissa and Wally's contact information, you know, and share thoughts, share questions, share ideas, because the feedback as a whole is what's going to make it successful, right? So we welcome anybody for that. Congratulations, you guys. I know that you two specifically have put in a ton of work on it, and I really appreciate the efforts and the late hours that you all wrapped your brains around this to make this a vision, right? We had a vision, and now it's a hard copy, and that's always a beautiful thing to see develop. So
Thank you.
So does anybody have anything else for Melissa or Wally, or about this in general before we move on?
I do have one quick question. Sorry to when you're about to move on, I'm like, I got a question.
Well, exactly. That's why I said anytime.
How do you expect to, what are you measuring for success for that? It's, do you have like expected outcomes or things that you're like, this is how we're going to compile the measurement, even though I think intrinsically there are some things that are beneficial that you just can't measure. But of course, a lot of times funders are like, they're big fans of having numbers. And I don't know if that's something that y'all are looking at specifically.
Yeah, I mean, I can address that. I wish Andy Clements was on this call. She is our evaluation person. There's a lot of ways that we're measuring outcomes. One is, I mentioned that we're using the TICS 10. I don't remember what that stands for, but that's a very short instrument that you start out with an agency, you administer it to the entire faculty, the entire workplace, get feedback, you implement the process, and then you can do, like, in the middle you can assess again, and then the end you can assess again, but also things like turnover rates, retention, employee satisfaction is another instrument that we're using. Also, like how many policies were changed, like were policies actually changed. So there's a number of things where, and Andy produced this. There is an evaluation document that answers your question in depth, but mostly almost every aspect of what we said we were going to do, there's a measurement of it. Like, did this happen? And they do want us, the state does want us to produce a peer-reviewed journal article at the end of the process, which is interesting. I mean, it's interesting as an academic, that's my bread and butter is peer-reviewed journal articles. So it's interesting for us, the state director, to want to do that. But yeah, I was glad, like, good, because I would love to get this out. But yeah, evaluation is a key component of it.
So a little bit more about the TICS-10. It's a trauma-informed climate scale,
Mhm.
and it's a very short, it's just 10 or 11 questions. So we have a 7-page evaluatory process, but the TICS-10 covers safety, trust, choice, collaboration, and empowerment. And those are things, Ryan, that are really hard to measure, as you all know. But it asks things, when I come to work here, I feel emotionally safe. You know, so it is that more nebulous kind of measurement based on personal experience, but it's a best practice and has evidence as to how that actually allows you to see if you're creating the change that you're trying to create in these more emotionally laden places.
Thank you for that.
Anybody else like going once, going twice? So I guess, again, thank you guys. And now we'll just kind of open the floor for additional announcements that you all may have or anything going on in your organizations. I had on here, but I'm not the person to speak to it. The announcement that Bristol's Promise has about a workshop and a training that we have coming up. But I think I'll let Melissa and Tina speak to it since they've been a little bit more heavily involved than I did. But if anybody has any announcements or anything that they want to share that's going on with their organization, please feel free to do so. Not everybody at once.
Well, I'll go. So I am from Tennessee Voices, and my role has changed at Tennessee Voices, and now I am in charge of Northeast Tennessee, and I am the peer family support specialist. So what I do is that I help families with special needs children, and I walk them through the process of advocating for them, like helping them with IEP, how to request an IEP, preparing them for that meeting for an IEP, and just giving that parent that voice, if helping that parent find resources and being able to just navigate the process of getting whatever their child's needs. We also do IEP trainings, we do parenting classes, and I am like, this is like the first time we actually have someone that is in charge of Northeast Tennessee, which is 8 counties. And that's what I'm doing at this time. And I'm really excited about that. So.
Congratulations.
Yeah.
That's awesome.
Thank you.
I do want to share a couple of things now that I'm not quite so taken off guard. So we do have a couple of things coming up. First of all, this weekend is there is a program being done at the Culp Center over in Johnson City. It is an ACEs training. It's trauma informed, and I apologize, I do not have the name in front of me. It is on our calendar, on our community calendar, on our website, but it is trauma informed and ACEs from an African-American Black perspective. ACEs from a Black perspective. Thank you, Brittany. Came to the rescue. And so that's at the Culp Center being presented by a newer group, the Northeast Tennessee Black Social Workers Association, Association of Black Social Workers.
It's the Black Social Workers Association.
Thank you, Tina. Y'all are just saving me today. My head is still in the trauma-informed workplace. So that is one of the things this weekend at the Culp Center at 10 o'clock, I believe. Nope, it is at noon.
It's
12 to 3.
12.
12 to 3, yeah.
Mhm.
12 to
I will
3.
be there if anybody else is going.
Yeah. And so I'm hoping to attend as well. The other thing is that Tri-Pride is this weekend. They are still looking for volunteers. So if any of you have some time, I know it's a busy weekend. There's a lot going on, but they're still looking for volunteers. For this group, October is typically when we have celebrated PACES Awareness Month, which is Positive and Adverse Childhood Experiences. So we usually will be reaching out to kind of partner with each of you to get you involved in that. If you have ideas, we would love to talk with you about your ideas. We typically do proclamations, and so we can help you write a proclamation for your city council or board of supervisors. And the other one that we're doing for October is Agents of Change on October 20th. We are bringing in Dr. William Cox. He is a nationally and internationally renowned trainer on implicit bias. And they have over 12 years of experience and evidence on their training. It's the first and the only evidence-based implicit bias training. And so that's going to be at the Bristol Motor Speedway banquet room on the 20th. Tickets are limited. Dr. Cox has asked us to limit it to just 100 so that it can be an intimate experience. He does breakout groups, and lunch will be provided. So I will share the link to sign up for that in the chat, and then I will be quiet.
So I also wanted to mention on behalf of the Strong ACC that we have an exciting event. I'm sure most of you have received the invite for, but if you haven't, I'll drop the Eventbrite registration link in the chat. But we have our regional symposium, which is basically a fancy word for our first in-person all-member meeting in over 3 years for the Strong ACC. So we're really excited about it. It's at the Bristol train station on Wednesday, September 28th. From 9:30 to 3, and we've got some exciting partnerships that are happening and panels, and also our first ever resilience awards. And so I wanted to mention that as well to this group, that we are recognizing Strong ACC partner organizations and individuals whose stories really exemplify what it means to be resilient. And so we will be awarding 3 individuals $2,500 each with that award, and then also 3 organizational winners of $7,500 each. So it's a really nice award there. And so nominations are open right now, and I'm going to drop my email address in the chat. So if you know of someone, it could be an individual that's, not a part of an organizational member of the Strong ACC that could be nominated. They might have just been touched by your organization in some way. So the organization itself, those nominations, of course, do need to be Strong ACC members. So anyways, I have a whole document that kind of lists out the criteria, but I'll put my information in the chat. And if you know of anybody or just want more information, just feel free to email me.
Thank you, Brittany.
Hi guys, I'm with Village Behavioral Health. We are a residential for adolescents in Knoxville, and previously we took their ages 13 to 17, male and female. We have recently lowered the age to 10. I know it's much needed. So now we're currently taking ages 10 to 17, and we do mental health disorders and substance use disorders. We're duly licensed for both. So it can be one or the other or both at the same time. Thank you.
Anybody else? Like, y'all are crickets today. Like, not a lot of feedback today. Y'all are crickets today. Which just means our meeting is shorter, right? Everybody knows that.
I think it means you guys have given us a lot of good things to think about. That's
yes,
yes.
I agree. I agree. All right. Does anybody else have any other announcements or anything they want to share? I will encourage you guys to check out the Bristol Promise public calendar. We try really, really hard. I know Erica, say hi, Erica. Erica tries really, really hard to make sure all of our community meetings and things that are happening in our region are on that calendar. So if y'all ever just need something to do and you want an educational opportunity, then those are typically listed on there. So I encourage you to check out our public calendar. Again, if y'all have any other questions or any last minute feedback that just pops into your head, please reach out to Melissa and to
I
Wally.
did have one thing. I just posted the job for the executive aide position.
Oh.
If you know anybody who might be looking for a job at an executive aide level, that's it. I posted it there, and it'll close. It can stay open until filled, but possibly as early as 5 days. So it's been out 1 day now. So if you know anybody, please forward them that link.
Nice. Thank you, Wally. Great. Okay, well, you guys, I appreciate all of your time today, and thank you for being here, and thank you for sharing this great opportunity for our community with your neighbors and your friends and your family and your business owner partners that you are aware of. We really appreciate you being here today, and I hope you all have a great rest of your week and a great rest of your weekend. Thanks, everybody.